Really lovely to be here. I'm going to talk to you a bit about why I think this is important, fundamentally. I'm currently the Senior Director of AI in the Tony Blair Institute. I left government in January, where I'd been in Downing Street for nearly 4.5 years as the head of data science. Before that, I had a little bit of an interesting career. I was originally a particle physicist. I had a brief stray into quantitative finance, worked for 3 hedge funds, all 3 of which dramatically went under. Curious statistical anomaly, difficult to explain. And I then went off and did a medical technology startup for 10 years. So sold it, was very tired after 10 years, and exited on the 2nd of March 2020, which was quite a bad time to be exiting anything. So I spent a few months at home wondering what to do with my children, who at that point were 2 and 4, and at some point thought, well, I'm really going to have to go and get a job. And it was quite late at night, after some glasses of wine, when I saw this advert for Director of Data Science in 10 Downing Street, and I thought, well, I'll chuck a CV at that, and was really surprised to get the job. And so I walked through the door on the first day, lovely black door, went upstairs, sat down with the then Principal Private Secretary, and he said, welcome. And I said, thank you very much. And he said, I've got one piece of advice for you. I said, brilliant, what is it? And he said, you have 6 months to have an impact. So I said, oh, right, great. What would you like me to do? And he said, oh, I don't know. And so that was the start of that. And I had to decide what to do, really. The background to this, of course, was COVID. At that point, the Prime Minister was Boris Johnson. I should say I had no political knowledge, understanding, or interest up to that point. And I was, appointed as a civil servant. But he and Dominic Cummings have been trying to manage this pandemic. And as part of that process, it had become apparent that that would be an easier thing to do if one had data and information. So quite a lot of work had gone in from the very small number of analysts and data scientists to try and get information from the NHS directly into Downing Street in order to make better decisions, what the infection rates looked like, where there were hospital beds a bit later on, where the vaccines were going, where there were gaps. And it was so useful, and the Prime Minister spent every day looking at this dashboard, that they thought maybe it would be a good idea to get some data about other things government was going to decide on. And so that was the motivation behind this job. So I thought, great, this is something I can do. I'm going to go in, going to get data from some places, going to do a few predictive models, and every time the Prime Minister makes a decision, I'm going to be there with this data, helping, and it's going to be brilliant. And so we figured out what the upcoming decisions were. And usually you've got sort of 1 to 7 days, really, to see what's coming down the pipeline and start to build models and get data and information. And so I'd go up to the policymakers and kind of got some lovely data to help you. Would you like it? And they'd say, no, go away. Which was a bit of a surprise. And I really had to address why everybody else wasn't quite as excited about this data and information and evidence-based policymaking as I was. And I started realizing that actually some of the most useful data information we have is not just the stuff that goes into the numbers around the decisions you're making, but it's actually about the way that people make decisions at all. And I started looking at evidence that would tell me why people weren't responding well to the kind of things we were coming up with. And the key study I saw, and I've thought about this a lot, I've done a lot of research, it's a fascinating area, but probably the number one most important factor here has to do with expertise. And in the 1980s, there was a man called Philip Tetlock. Raise your hand if you've heard of the Tetlock study. Fantastic. Only one person, 2 people, everybody else, you're about to have your mind blown, this is amazing. My favorite study ever. What he did was he got about 286, I think it was, policy professionals, experts, and he asked them to predict the future. He had 100 questions along the lines of this thing that's happening at the moment, in 20 years' time, will it be happening more or less, or kind of the same as now? And he got them to make these predictions. And he patiently waited 20 years, and then he wrote a research paper. And Daniel Kahneman commented on the research paper, and he said that these policy professionals had done about as well as monkeys throwing darts at a dartboard when it came to predicting the future. They'd done slightly better than pure random chance. They'd done significantly worse than what the paper rather fancifully called the minimally sophisticated statistical model, which meant just draw a line through what happened before and carry on. They did slightly better in groups, which can be quite good news. There's lots of data and evidence about that. They did worse in their field of expertise than outside of it. So if you're an educational policy professional, you are more likely to get the future of defence right than education. And they were highly, highly confident that they were going to be right. And in fact, when presented with how badly they'd done, they came up with a range of very similar sort of excuses. Well, I was nearly right. If only this earthquake hadn't happened, I would have been right, so on and so forth. And this tells us a couple of things. It tells us that experts, people, when we consider that we're experts, we're really confident that we know what's going to happen. And when you think about it, predicting the future is the basis of decision-making. I think if I do this, then that, therefore I should or shouldn't do it. And people believe that they're very good at that. And they're not, they're horrible at it. And this is all of us, it's not just policy professionals, myself included. We're also wildly overconfident in our abilities. And we do a very bad job of looking back and assessing the fact that we got it wrong last time, we should change the way we behave. Instead, we'll say, well, I was nearly right. And when you then look at the way that people are making decisions in government, this starts to become very informative. Of course, they didn't want us coming in with our bits of data because they were experts and they already knew what the right thing was to do, which was sort of amazing, really. And so we had to find techniques to get people in a position where they could change their minds. And there's a lot of data and evidence around that. There's a lot in how you get people and yourself to make better decisions. A lot of it's about framing. Did you know that you can get people to make a better decision by showing them numbers and data? It doesn't have to be numbers and data about the thing that you're talking about. If you're about to go and buy a house and you want to make a really good investment decision, whip out a bag of Walker's crisps, read the calorie contents, and you will put your brain into a more analytical state. So when we go and show the Prime Minister a dashboard, the fact that he's looking at numbers at all is incredibly helpful, even if the numbers are irrelevant. We can also get people to make very bad decisions with numbers really, really easily, and there's a huge responsibility there as well. There's another fascinating study about the criminal justice system. And what they did is they got a number of judges with, on average, about 10 years of judging experience. And the assessment was about quite minor crimes where generally the prison sentence is going to be between 1 and 3 years. That's kind of what you're looking at. And he's going to hand out a prison sentence. And they planted journalists to speak to the judge before the trial. And the journalist said, "Ooh, do you think you're going to give them 3 years?" Just by saying that, you can increase the average length of the sentence by 8 months. If you say 1 year, it goes the other way. People anchor to numbers they hear, and it changes their behavior. This is phenomenally useful if you're negotiating your salary. Start high. 8 months extra, but it's very bad news if you're trying to get a fair criminal justice system. So the way we use numbers and data turns out to be about much more than just the information that goes into this thing. So I was doing quite well in Downing Street at this point. I'd started off with 4 people and frankly very little support. No one really wanted all these data weirdos wandering around. But actually it turned out to be very useful. So a couple of years in, I got a team of 25. For context, Downing Street's never more than 300 people. It can go down to about 100 people. And the majority of them work in events and visits, security, IT, that sort of thing. So we're at this point the second biggest Downing Street team. And ChatGPT hit. Now, I hired professional data scientists. They, of course, already do all kinds of machine learning. We were already using large language models, actually, trying to solve one of the problems that really bothers me, which is about maternal death rates. So in the UK, for every roughly 10,000 babies that are born, one of the mothers dies. I think that's still really high. If you know 100 women and they know 100 women, one of them's dead, if they've had, children. And in America, it's 10 times higher, 1 in 1,000. And if you're black, you're 4.5 times more likely to die in childbirth. And I don't think this is good enough. So we were using large language models to try and solve it. Because you can't, you'll be relieved to know, whip out people's personal health records from Downing Street, we needed to find a different way to try and answer this question of what was going on. And so we were using earlier versions of large language models to read all the NHS incident reports. About 70% of the NHS cases where someone comes to harm or very nearly comes to harm and it requires an incident report are in maternity. And we're just in the middle of this when ChatGPT hit. And well, the first thing that happened was 6 people declared themselves the new government head of AI because that's how that works, people wherever you go. And it was kind of really exciting, and it really was just what is happening. This is a massive change. We've seen this shift in the way technology is working, and we hadn't seen it coming. And in fact, the OpenAI engineers that built ChatGPT didn't see it coming. They turned it on one day and went, didn't expect that. As a technologist, I and pretty much everybody else had failed to predict the future there. We also failed to predict DeepSeek. So very often people will say to me, what's next in technology? And I say, I have evidence that I've got absolutely no idea. And in fact, it's less sensible to ask me than to ask the greengrocer, because I'm an expert. I'm going to do a worse job than the average man on the street. So we didn't see it coming. And very early on, I had this conversation with Geoffrey Hinton, who is, of course, very much on the side of, this is a threat to humanity. And it was terrifying, actually. It was a really frightening conversation. Just me and Alex Burkhardt, who was Cabinet Office Minister at the time. And there were a few things that, in retrospect, I sort of was very naive and slightly foolish about. I remember him sort of explaining the idea that once you get to a super intelligent, AGI, a general intelligence, then super intelligence is inevitable, because your human brain is bounded. It's a certain size as a skull. You can't get smarter, but with an artificial brain, you just need more processing power, more access. It will speed up immediately, depending on what resources it has. So there's not really a difference between those two things, which I hadn't given much thought to before, because I suppose it hadn't been particularly pertinent. But at some point, I sort of went, gosh, you're sort of saying this is going to be the end of humanity. What? I said, look, if it really gets that bad, if we absolutely had to, I guess we could turn the power off, right, and try and kind of regain control. And he said, no, you've completely misunderstood. You've misunderstood the threat. He said, Donald Trump managed to get several thousand people to invade the US Capitol on Twitter, and no one thinks he's a superintelligence. If you get superintelligent AI on Twitter, turning it off won't be the problem. It's how it changes people that, in fact, can be the threat. And that was frightening. And so we set up the Safety Institute, and we had this safety summit, and a lot of work went into that. And I was sitting on a lot of panels. What's the future of AI? I don't know, mate. What's the biggest threat? And I started to say, look, I think the biggest threat might be us not doing it, right? We're putting all this effort into safety and alignment, but we can't keep running the National Health Service the way we're doing. It's not possible. We can't keep funding it. We are not going to be able to provide people with the services that we want to and that they deserve by continuing to run public sector the way we do now. The biggest threat might be not going and using this AI to make people's lives better, to be able to afford the kind of things you want, to be able to get to preventive medicine and not waiting until people are sick. And there's such a lot of opportunity in this space. You could wrap around every child from very early until they're an adult, not just personalized education, but safety and well-being checks. You could get everybody preventative medicine. You could get everybody the best tests early on and save all that money in waiting until people are really, really sick. It could go the other way as well. So, at the risk of predicting the future, there's definitely a world that comes where the technology really gets into the hands of only the people that already have the money. There's a world where the big tech companies become the only employers, and some people are incredibly, phenomenally well paid, and many more people have no money, and the idea of measuring sort of your country's success by GDP becomes absolute nonsense. And some people have great healthcare and great education, and other people it gets sort of relatively worse for. And I started to get more and more worried about that sort of bifurcated future, particularly as some of the world leaders started to want to move us away from diversity, inclusion, access, etc. And I'm a very, very big believer in inclusion. And not just because it's a nice thing to do, but because, again, we have a lot of statistics. If you have two groups of people, there's studies that show that the more diverse group of individuals will make a better decision 87% of the time. If you're hiring a team and you're saying, we're just going to hire the right person for this job, you're doing yourself a disservice. You should hire the right person to make your team better. We've got evidence on that. So reducing diversity and inclusion can have a really negative consequence on how well we perform, really, as a species. And so I was in Canada when the tariffs hit. It's not often you get to see a room full of really angry Canadians if you're not in ice hockey space. So it's quite informative. But they were all AI technologists, and they were upset about the tariffs, but they were also upset about what Trump was saying about the future of technology. So anyway, I was looking at the sea of technologists, and I thought to myself, I don't know if it matters that much what Donald Trump and other people say about how we build technology, because the people who control the future are the people that are building it. And the people that are building it are, in many cases, in or adjacent to AI and technology. The consumer is also building the future, what you will and will not accept in terms of how technology is marketed and sold to you. And I don't believe in predicting the future, but I do believe in something else, which is deciding the future. And so for me, what we need to do next is not guess at what's coming over the next quarter. It's be prepared, watch for the changes, but also have intent, decide what the future should be. And for me, I think the future should be a world where inequality is reduced, where every child is safe, where everybody gets really good healthcare and is prevented from becoming sick, and where everybody has the opportunity for a productive, successful, and happy life. And that is the future that I think that we should be building together. So it's really encouraging to see so many people engaging in this sort of effort to come together and figure out what to do next. I wish you all the very best of luck, and please join us in building a more equal future. Thank you.